There were 246 cases reported today from yesterday of COVID-19. All were locally acquired. Of those, 121 of the cases are linked to known outbreaks and cases. This now takes us to some 1,619 active cases, all but 5 of those are locally acquired. The age breakdown continues to point to this being a pandemic of the unvaccinated. There were some 252 aged between the ages of 0 and 9, 260 between 10 and 19, 411 aged in their 20s, and 262 aged in their 30s. And when you look at the number of cases under 50, 87% of those cases are under 50 years of age. There are currently 92 people in hospital, 26 are in ICU, and 14 are on a ventilator. In regards to vaccines, yesterday was our highest number for a Sunday of vaccines delivered through our state-run clinics at 26,955. Add to that the work of our GPs, our pharmacists, primary health networks and others. We are looking for a very solid number of vaccines from yesterday. In our state-run clinics, we are now at 2.61 million vaccines being delivered through those clinics. We have now at 60.9% of first doses admitted to people over 16 in Victoria. That's a good number, but it's well on the way to 70. We've just got to keep the work going to get us there as soon as possible. And we are, of course, well on the way to our million target over 5 weeks, but we still have another 316,000 vaccines to go to get us to that milestone. Some 30,000 bookings were made yesterday into the state-run clinics, and that again was a very good number for a Sunday, but there is always more that can be done. There are currently 10,000 available first dose AstraZeneca appointments available and 1,000 available first dose Pfizer appointments available over the next 7 days. This does not include the priority program for our Year 12 students, which I'll come back to. Just to analyse a bit further the hospitalisation figures and the notion that vaccines not only keep you safe, but are our pathway to supporting our public health system, our hospitals, and getting out of this pandemic. We did a bit of a breakdown again of the vaccinated status of people in hospital. Of the people in hospital yesterday, 13 in hospital were not vaccinated and were not eligible at the time they were diagnosed, under 16-year-olds. 67 in hospital were not vaccinated but had been eligible for the vaccine at the time they were diagnosed. 10 were partially vaccinated. 1 person was fully vaccinated yesterday, but the good news is that person has been discharged as well enough to go home today. So I can't reiterate this as as many times as we possibly can and in as simple terms as we possibly can. This current outbreak is targeting the unvaccinated because that's where the virus will go. Our best way in which to protect ourselves, our family, our community, and to get to the other side of this is to get vaccinated and therefore protect yourself. Perhaps even more importantly, do your bit to protect our public health system and make sure that any wave of the unvaccinated protects our public health system. In regards to the school blitz for VCE and final year 11 exams, Those bookings opened today, and the vaccinations for that start tomorrow and run until the 19th of September. Our parents, carers and families have received communications from the schools over the weekend in particular, some a little bit earlier, including the priority access booking number. So please check your emails or however else you usually get your information from the school, sometimes online, Compass, all sorts of other communication mechanisms that schools engage with their families around, making sure that those final year students get that priority access to get them into the GAT, to get them into their exams as soon as we possibly can. This also picks up our Year 11s who are completing their 3-4 subjects can also book from Wednesday. This is making sure that our Year 11s and eligible Year 11s and 12s get that certainty about making sure that their exams are going to be held, that they get the opportunity to hold the GAT, to participate in exams, and whilst we're doing it, keep both the students and the staff safe. So I just also wanted to use this as an opportunity to just reassert that if you have been vaccinated, it's still important if you show signs of coronavirus to get yourself tested. And whilst you're infinitely better in being protected and reducing your chances of hospitalisation and certainly death, you nonetheless can still, in more limited circumstances, pass the virus on. So it's still important that even as our vaccination levels grow, that we continue to be alert to the virus and to get tested with even the earliest possible symptoms becoming apparent.